About a decade ago, Robert Schwartzman, who was one of the pioneers in the use of ketamine for complex regional pain syndrome, encouraged me to add this as a modality of treatment for my patients with CRPS, and basically told me that if I didn't, I really would be depriving patients of something that was outstanding. And we've had great success with ketamine, and patients come from all over the world now to receive ketamine here. We've done well over 1,000 infusions, and we're actually analyzing our data in terms of side effects at the present time. But one of the things we know about ketamine is that 50 years ago or longer, when it first became an anesthetic, it had a lot of bad press of causing hallucinations, and we've truly mastered how to deal with that so that the hallucinations are not troublesome to the patients. There can be other side effects, but we've learned to address all of them. If a patient wishes to be considered for ketamine, we do a trial of 3 infusions over a short period of time, usually within a week. And we do escalating doses, and we want to determine 2 things. If the ketamine starts to be effective, and if the patient can tolerate any side effects, or we can address any side effects that the ketamine might cause. And we're very effective at doing that during the 3, and that sets us up for the protocol of doing 10 over a 2-week period. When we administer 10 infusions to a patient over a 2-week period, approximately half the patients don't need to come back for any treatment. And the other half notice at about 12 weeks that the symptoms start coming back, and we've more recently started advising patients to do some boosters at the beginning, a month later and 2 months later, to prevent the need for having to come back to get a booster treatment of 3 infusions at 12 weeks. If we use functional rehabilitation after the ketamine, the patients tend to have a more prolonged effect from the ketamine, because we're getting the patients to use all their limbs and start functioning normally, so they're less likely to fall back into what they fell back into.